Hi everyone, welcome to Heal Street. Today we are going to talk about back pain. You know, that dull, aching feeling in your lower back that just won't seem to go away? Or maybe it's more of a sharp, stabbing pain that makes you miss work, or worse yet, keeps you up at night. Whatever the case may be, back pain is no joke. In fact, it's one of the most common reasons we seek medical attention. So today we're gonna dive deep into this all too familiar discomfort and explore its potential root causes, symptoms, and even some treatment options so you can find relief once and for all. Just remember, we're not doctors, so always consult with a healthcare professional for personalized advice. With that said, let's get started. Back pain can manifest in various ways, from a mild ache to a searing, debilitating agony. It can also stem from different parts of your back, including your upper back, mid-back, and lower back. And the pain might even radiate to other areas like your hips, legs, and buttocks. But that's not all. Back pain can also come and go or persist for weeks, months, or even years. And sometimes it might not even have an obvious cause. Let's take a closer look at some of the common symptoms associated with back pain. First off, you might experience muscle tightness or spasms in your back, which can worsen with movement or when you try to stretch the affected area. Next, there's tenderness. When you have tenderness in your back, even the slightest touch or pressure can feel uncomfortable or painful. Loss of range of motion is another telltale sign. If you find it difficult to bend, twist, or stand up straight due to back pain, it could indicate an underlying issue. Plus, you might notice an abnormal curve in your spine, which suggests a problem with your spinal alignment. And don't forget about the less obvious symptoms. Changes in bowel or bladder function, unexplained weight loss, or fever could be related to back pain, especially if they occur alongside other back-related symptoms. These additional signs might seem unrelated at first, but they could point to a serious condition that needs attention. For example, changes in bowel or bladder function may indicate a problem with the nerves connecting to the spine, while unexplained weight loss and fever could be signs of an infection or tumor. So it's essential to pay attention to all the symptoms you experience, not just the ones in your back. By being aware of these potential indicators, you can take the necessary steps to address your back pain effectively and prevent further complications. Remember, understanding your symptoms is the first step towards finding relief. So pay attention to what your body is telling you and do not hesitate to seek medical help if needed. Now that we've covered some of the common symptoms of back pain, it's time to dive into the root causes. Back pain can stem from a variety of sources, and understanding where the problem lies is crucial for finding the right solution. One common culprit is poor posture, which can lead to muscle strain and imbalance. Whether you're sitting, standing, or sleeping, maintaining proper posture is key to keeping your back healthy. Another frequent cause is a lack of physical activity. When you're not active enough, your muscles can become weak and inflexible, putting added stress on your back. It's important to find activities you enjoy and incorporate them into your routine regularly. But remember to start slow and gradually increase the intensity and duration of your workouts. Additionally, certain occupations that require heavy lifting or repetitive motions can contribute to back pain. If your job is physically demanding, make sure to take breaks, lift properly, and use assistive devices when possible. Moving on to more serious causes, disc-related problems are a common source of back pain. The discs in your spine can bulge or rupture, putting pressure on the nerves and causing discomfort. This often happens due to age-related degeneration or injuries. Fortunately, most disc-related issues can be treated with medication, physical therapy, or minimally invasive procedures. Spinal stenosis is another potential cause, especially in older adults. This condition involves the narrowing of the spinal canal, which can compress the spinal cord and nerves. As a result, you might experience symptoms like numbness, tingling, or weakness in your legs. Fortunately, treatments such as physical therapy, injections, or surgery can help alleviate these symptoms. Injuries play a significant role in back pain too. Car accidents, falls, and sports-related trauma can all cause sudden, severe pain and long-term discomfort. The severity of your symptoms will depend on the nature and extent of the injury. While some injuries heal on their own with rest and physical therapy, others may require medical intervention. And let's not forget about underlying medical conditions. Conditions like arthritis, osteoporosis, cancer, and infections can all affect your back and contribute to pain. Managing these conditions effectively is crucial for controlling back pain and preventing further complications. Finally, let's discuss how our daily choices impact back pain. Smoking can worsen existing back pain and slow down the healing process. It's best to quit smoking to maintain overall health and reduce the risk of other health problems. Similarly, excessive alcohol consumption can weaken the muscles and ligaments in your back, making pain worse. It's essential to drink responsibly and in moderation to support your body's well-being. With a better understanding of the causes of back pain, let's move on to effective treatments. But before that, let's talk about food recommendations and modifications. When dealing with back pain, it's essential to nourish your body with the right foods and make modifications to your diet to support your recovery. First, focus on consuming anti-inflammatory foods like fruits, vegetables, whole grains, and lean proteins. These foods can help reduce inflammation and alleviate pain. Omega-3 fatty acids found in salmon, walnuts, and flax seeds are particularly beneficial for back health. Additionally, getting enough calcium and vitamin D is vital for maintaining strong bones and preventing osteoporosis-related fractures. Good sources of calcium include dairy products, tofu, and leafy greens, while vitamin D can be obtained from sunlight, fatty fish, and fortified foods. To reduce the risk of disc degeneration, limit your intake of processed foods, sugary drinks, and saturated fats. Instead, opt for whole, unprocessed foods as they provide essential nutrients without the added inflammatory effects. Staying hydrated is also crucial for maintaining good posture and preventing disc-related issues. Water helps keep the discs in your spine hydrated and functioning properly. Aim to drink at least 8 cups of water daily to keep your body well hydrated. It's also important to consider modifying your diet based on individual needs. Some people might benefit from a low-salt diet to reduce swelling and inflammation, while others might need to increase their fiber intake to maintain healthy bowel movements and prevent constipation. For those experiencing back pain due to kidney stones, a high citrate diet has been shown to be effective in preventing their formation. Incorporating foods rich in citrate, such as citrus fruits, berries, and tomatoes, can help reduce the risk of future kidney stone development. Additionally, managing your diet plays a vital role in treating gastroesophageal reflux disease, or GERD, which can contribute to back pain. By reducing the consumption of acidic and spicy foods, caffeine, and alcohol, you can help alleviate symptoms and prevent complications. When it comes to finding the right treatment for back pain, it's important to explore various options and work closely with your healthcare provider to determine the best course of action. Depending on the underlying cause and severity of your symptoms, treatment plans may vary. For instance, physical therapy is highly effective in addressing muscle-related back pain. A physical therapist can guide you through exercises to strengthen your back, improve flexibility, and restore proper movement patterns. In some cases, they may also recommend assistive devices or therapies like acupuncture or electrical stimulation. Another treatment option is medication. Over-the-counter pain relievers like non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen or naproxen, can help alleviate mild to moderate pain. However, it's essential to use these medications as directed, and consult your doctor if you have any concerns or pre-existing conditions. For more severe or persistent pain, your doctor may prescribe stronger medications, including muscle relaxers, opioids, or nerve pain medications. Opioids should be used cautiously and under close monitoring due to their potential for addiction and side effects. Nerve pain medications, on the other hand, can help alleviate pain signals sent through the nerves in the spine. In certain situations, your doctor may recommend steroid injections as a way to reduce inflammation and alleviate pain. These injections typically involve corticosteroids, anti-inflammatory medications delivered directly into the affected area via syringe. The procedure may be repeated several times, depending on the response to treatment. Steroid injections can provide quick relief, but they do come with potential risks and side effects, such as increased blood sugar levels and suppression of the immune system. Therefore, it's essential to weigh the benefits and risks before undergoing this treatment. If conservative treatments don't provide relief, you might need to consider surgical interventions. Various surgical procedures are available to address specific conditions causing back pain, such as removing a herniated disc or decompressing compressed nerves. However, surgery should be considered as a last resort when other treatment options have been exhausted, as it comes with its own set of risks and recovery times. While these treatments offer potential relief, it's important to remember that not every approach works for everyone. Finding the right combination of treatments often requires trial and error, and it's essential to communicate openly with your healthcare provider throughout the process. Additionally, alternative therapies like yoga, Pilates, and Tai Chi can complement traditional treatments and help manage back pain symptoms. These practices can improve flexibility, strengthen muscles, and promote relaxation, all of which can contribute to overall back health and well-being. As we wrap up our journey into the world of back pain, it's crucial to remember that back pain is a complex and multifaceted issue. While there's no one-size-fits-all solution, understanding your symptoms, root causes, and available treatments is the first step towards finding relief. From making positive lifestyle changes and incorporating anti-inflammatory foods into your diet to exploring physical therapy, medication, or alternative therapies, there's a path towards a healthier, more comfortable back. So don't hesitate to reach out to your healthcare provider, seek support, and explore the resources available to you. Your back deserves the care and attention it needs to keep you moving comfortably through life. There you have it. Please like, subscribe, and share if you find the video useful and informative. Have a nice, healthy day.